Okay, welcome to the July Central Safety Group meeting on the COVID-19 response in Victoria, a union perspective. Just before I introduce Dominic, I'll go through a little bit of housekeeping for the process. It's also with some sadness, I also let people know that Adrian Goldberg has stood down from the Central Safety Group Committee as he's moving into a new non-safety executive role later on this year. So if anybody's interested in joining the committee, there will be a vacancy coming up. During the presentation of Dominic, you can keep your phone on mute. If you have any questions, you can use the chat, but we'll try and save 10 minutes towards the end for questions. And once we close the recording, there may be opportunity for further questions. Yes, and now I will introduce Dominic. So Dominic graduated from law and since then has had extensive experience representing workers in both industrial and health and safety matters. Today he'll be giving a presentation. Oh, actually, sorry about that. Dominic is the lead organiser of the OHS team at the Victorian Trades Hall Council since 2020. And in this role, he's worked with affiliated unions in their collective efforts to campaign for safer workplaces and better conditions for workers. And I think this is certainly something which is very dear to the hearts of many of our members. So I'll hand over to Dominic to talk about the COVID-19 response in Victoria, a union perspective. Welcome, Dominic.
Hello, and thank you very much for that. If you just give me a second, I will get myself organised by sharing the screen. There we go.
Thank you.
So, yes, good afternoon, everyone. Thank you for the opportunity to address everyone. I wish to acknowledge the Wurundjeri people of the Kulin Nation, the traditional owners of the land on which I stand. I pay my respects to their elders, past, present and emerging. This land was stolen and never ceded, always was and always will be Aboriginal land. Today, I want to reflect on some of the main challenges that the union movement have faced in Victoria since March 2020 as a result of the COVID-19 pandemic, along with the ways these challenges have been addressed and the lessons we can learn. One thing we have learned about COVID-19 is that suppression and elimination of the virus in the community requires a collective effort. Success in suppressing the virus is a result of our united efforts and compliance with public health directions as set out by our public health officials. There are no absolutes here, but to succeed in eliminating the virus, we need a critical mass of people doing the right thing at the right times in the right areas. The second lockdown in Victoria started on 8th of July and was largely driven by workplace transmission. This transmission was driven by specific industries whose employees disproportionately have certain shared characteristics. WorkSafe likes to talk about workers who have these characteristics as vulnerable workers. This includes casual and labour hire workers, new workers in their probation period, young workers, recent migrants, visa workers, and very often it has a combination of several of these factors. The work has a combination of several of these characteristics. It's our view that no worker is inherently vulnerable, but rather the systems and structures of employment in Australia marginalise and exclude workers with these attributes and means they're more likely to be exploited. Whilst I'm not suggesting that these are the only elements in the spread of COVID-19 in Melbourne, each of the industries I will discuss has had its own particular risk factors. That being said, insecure work has been a common thread in driving COVID-19 transmission, revealing the prevalence of vulnerable workers in essential industries and its flow-on effects to society. Knowing my audience, I want to look at it at another way, through an OHS framework. In the principles of the OHS Act, at Section 4, employers and employees should exchange information and ideas about risks to health and safety and measures that can be taken to eliminate or reduce those risks. And employees are entitled and should be encouraged to be represented in relation to health and safety issues. In industries and workplaces where marginalised, excluded and disempowered workers have lost their ability to speak up against unsafe work practices, to establish independent OHS structures, such as forming DWGs and electing HSRs and having them independently trained. And in industries where workers are coerced not to contact or join the union, the consequence can only be worse OHS outcomes. Today, to illustrate my point, I intend to spend quite a bit of time talking about essential work and focusing on several industries, then looking a bit at working from home and the attendant complications there, talking about the government assistance, what's worked there and how that all came about, what didn't work. And finally, looking at the VTHC COVID Safe program as well and spending a couple of minutes talking about that. And if we have time, we can talk about Sydney as well. See how we go. So, essential work. The first industry I wanted to speak about is the meat industry. The meat industry was one of the hardest hit industries last year. Outbreaks in the meat industry were not a phenomenon limited to Victoria. As of 1 June 2021, almost 60,000 meat workers in the United States have contracted COVID, with over 300 deaths. Similar outbreaks in abattoirs and meatpacking sites have occurred worldwide. One of the earliest outbreaks in Victoria was the Cedar Meats outbreak in April-May 2020, which resulted in a cluster of 111 cases. By the end of July 2020, other clusters included Somerville Retail Services, the Australian Land Company, JBS in Brooklyn, Bertocchi Small Goods, Ingham's Thomastown, Golden Farms and Hazel Deans. Over 650 cases, and there's one fatality that's also being investigated as well. Anywhere from 202 cases linked to a cluster down to just a handful. Oops, sorry, there we go. Certainly there are a number of physical factors that place these workplaces at higher risks, such as cold and damp or hot and humid conditions and poor ventilation, hundreds of people starting or ending their shifts at exactly the same time each day, making it near impossible to socially distance. And this is not just in terms of workstations, but there are other congestion points as well. Washrooms to and from the production floor and locker rooms, lunch rooms as well. It's just not possible really to stagger the shifts with the way the work is done. And to socially distance through these congestion points would mean that it takes 45 minutes to an hour to get a shift started. There are also other characteristics that make abattoirs especially susceptible. High numbers of casuals on site. At Cedar Meats, over half the workforce is provided by Labour Solutions, a labour hire company. In the days leading up to the outbreak, the employer dismissed concerns from workers that they had COVID as rumour and innuendo. Oh, look, there's an article as well on the slide that shows that, or talks in more detail about that. The initial response was from, the initial positive response was from a Labour Solutions worker, and the government took too much time, quite frankly, in tracking down his host employer and shutting down the site. Cedar Meats workers also reported that they were not given the option to stay home from work until 5 days after the first case was identified, were not issued face masks until 6 days after the first case was identified, and they participated in mass meetings of between 15 to 70 workers with no physical distancing, standing and sitting next to each other. These are in the early days of the pandemic when the risks were perhaps not as well understood, but certainly looking back now, thinking as that occurred is just kind of mind-boggling. I want to look at this issue of casualisation in a bit more depth. I want to speak about it because, generally speaking, low pay and casual work is endemic in the industry, and casual workers do find it very difficult to speak up. So I want to speak a bit about Midfield Meats. It's probably worthwhile saying there wasn't a cluster that came from Midfield Meats, but I think some of the issues show why it's so difficult for casual workers to speak up, even about very pressing concerns. Midfield is a large employer in the Warrnambool area that engages hundreds of visa workers on temporary visas. Many of these workers are significantly in debt, having paid amounts of between $20,000 to $70,000 to recruitment syndicates to get a visa for Australia. The syndicates promise them permanent residency after 3.5 years service, This is not a representation made by Midfield Meats, but certainly 5 years later, not one worker has had this promise fulfilled. Under the conditions of the visa, anyone sacked has 28 days to find a new sponsor in their relevant industry or be deported. In response to workers airing grievances online and in the media about, amongst other things, verbal abuse from supervisors, workloads, and difficulty in having workplace injuries appropriately dealt with, one of the family members of the owner is alleged to have told workers that he had personally called the immigration minister to stop their chances of ever getting a visa because they were telling lies. Now, I say allegedly, if you read the newspaper articles, it appears there is a recording of that being said, so people can draw their own conclusions there. This workplace culture and attitude is not unique in the industry. I hope everyone here appreciates the risks and the tremendous personal costs of speaking up about anything, including pressing OHS issues. Right, back to COVID. In response to these outbreaks on the 21st of May, WorkSafe released guidance to assist the industry. It had screens, bubbles, PPE, physical distancing, cleaning, shared spaces. There were over 30 recommendations in the guidance. Some are helpful and some are not. For example, encourage employees to avoid carpooling. Why do workers carpool? To begin with, shifts start and finish outside public transport hours. Secondly, a number of these factories are just not in a place that's conveniently serviced by public transport. So if they don't carpool, how are they supposed to get to work? As a result of the low wages, many of these workers share housing as well, which is why they're carpooling. But if workers are sharing houses and working different shifts, it cancels out the benefits of the shift bubbles as well. That's also a control that's suggested. Another control, for example, is process lines being moved. I mean, that's major capital expenditure and goes back to reasonably practicable. Unions in the industry report that they're working with HSRs and members to try and implement the controls that are feasible. They're assisting injured workers claim workers' compensation. Unfortunately, a number of workers were too scared to even claim workers' compensation and just funded their own quarantines. So I think the true numbers of how many people were actually work-related COVID cases is perhaps underplayed. The other thing they report is, 10 months later, there's still a number of workers who have long COVID and have yet to return to work. While some, and particularly the major players, have implemented better controls, if COVID does get out into the community again, it is probable that meat works will still be vectors of contagion. Aged care. Oh, I don't know. I didn't see if there were any questions, but I'll keep on moving. You can just jump in if there are. Aged care. Aged care homes became synonymous with COVID clusters last year. Aged care homes don't just carry a risk of infection for workers, but for the elderly residents who are most at risk of showing severe symptoms and dying. 655 of the 801 Victorian deaths were from residents of aged care facilities, and centres had a 33% fatality rate for their residents. I think in actual fact, there were even more workers who were affected in aged care nursing homes than there were residents. I should have probably double checked that before I said it. Let's break down the aged care industry in Victoria. 9% of aged care places are in Victorian government run public aged care facilities, with the caveat that these are disproportionately, although not exclusively in the regions. 3 residents contracted COVID-19 at the government-run centres and there were no deaths. Victorian public aged care facilities have state legislative ratios of 1 nurse to 7 residents plus a nurse in charge in the morning, 1 nurse to 8 residents plus a nurse in charge in the evening, and 1 nurse to 15 residents overnight. The remaining 91% of aged care places in Victoria are provided by private and not-for-profits who are legislated and regulated by the federal government. The current federal government will not mandate staffing ratios, staff wages, or even whether staff should work in multiple homes, subject to an exception I'll talk about in a minute. They leave all these decisions up to individual providers. Facilities do not provide details about their staffing levels, but in the last 18 years, the ratio of nurses to personal care workers has dropped according to the recent Royal Commission. Typically, a centre may only have 1 registered nurse in a management role, overseeing personal care workers and enrolled nurses, and that registered nurse would not does not provide direct care, and often that can be for 90 or more residents. The free market rules and savings are made, but where does the money go? Some answers may be found in the Royal Commission into Aged Care Quality and Safety, which was established in late 2018. This report found substandard care can occur in both routine areas of care like food, medication management and skincare, but also complex care such as the management of chronic conditions and dementia. The media also started to ask questions about two of the nursing homes worst hit, St Basil's, where 45 people died, and Epping Gardens, where 38 people died. So here are a couple of the headlines that came out in relation to St Basil's. I think, yeah, the church received 14.6 million in exorbitant rent. I think the point in that article was they were paying double market rates for to the church. And there's some of the media articles about Epping Gardens. Risk factors that led to COVID fatalities have been identified as including poor infection control and inadequate emergency planning. Let's be clear, every workplace in Victoria should have a COVID safe plan, but aged care facilities should be more familiar with this concept than most, being a sector in the health industry and having to have had infection control plans for many years. It identified inadequate PPE and training on the use of that PPE. I note that in as late as July last year, the health unions were publicly calling for more PPE to be made available to the aged care. Severely depleted staff levels due to quarantining. The regular staff all had to quarantine because of the extremely infectious nature of COVID. Those brought in to care for residents were young, had little experience in aged care. Apparently many spoke only basic English and they had little preparation, training or supervision. Putting aside anything else, I suppose what we really should be aware of as occupational health and safety practitioners is the number of safety obligations and breaches of putting these, I mean, there perhaps wasn't much choice, but the lack of emergency planning that led to these workers being placed with very little training and the obligations that employers owe to their staff there. Another thing that happened as a result was, putting COVID to one side, is the residents of aged care facilities have complex medical needs. Handovers between shifts collapsed and health practitioners will tell you the importance of those handover meetings, and families were not able to get information about their loved ones. At many aged care centres, there are poor OH&S structures. Many centres don't have elected HSRs or DWGs, and those that did have those structures collapsed as reps were stood down to isolate. Another factor is chronic understaffing. These centres are being run on the bare bones. Health unions have long campaigned to stop systemic understaffing in private aged care for both patient and staff safety and implement the same type of ratios that we see in the Victorian-run public aged care facilities. Final point to make is the casualisation of staff is widespread. Workers are often only offered short shifts on low wages, and to make ends meet, they have to work across multiple aged care facilities. This is how the virus was spreading so quickly from one aged care home to the next. The Victorian-run centres have clear policies in place that have made sure workers don't work across sites. Staff working across facilities is not happening in the public system. As a result of the outbreak last year, the federal government did change its guidelines for the aged care homes it oversees so that workers with more than one aged care employer needed to choose a primary employer. These guidelines were only mandatory. These guidelines are only mandatory when the government declares an outbreak, which is a very reactive control. And indeed, I think they were quietly lifted in November last year. Otherwise, the government can do nothing to stop staff from working across multiple sites to supplement their income. And that's why in April, May this year, when we had the second lockdown, we found once again staff were working across multiple facilities. It's worth noting as well that we have a botched vaccine rollout. Residents have been vaccinated, but workers were not. This has only exacerbated the spread of the virus. Experts have recommended that a strong control measure is having detailed and well-defined COVID-safe action plans, as well as a larger number of permanent staff, rather than relying on such a casualised workforce. It is worth mentioning as well, the Health Workers Union did inform me of one interesting case study. TLC is one of the only private aged care providers in Australia that has ratios in their enterprise agreement. They have 11 locations through Melbourne and Geelong and didn't have a single COVID case in the second wave. They attributed this to the presence of doctors and chronic disease management nurses on site, strict control of infectious disease outbreaks in the homes, and the rollout of their outbreak management plan, which they've used in the past to contain influenza and gastroenteritis. Speaking about influenza, and I know this is probably a bit of a tangent, but let's consider the number of fatalities that we have each year of influenza. We have good and bad flu seasons based on the particular strain, but in 2020 it was a particular low, and that's been attributed to all the controls that were put in place to control COVID, also worked in suppressing the flu virus. The majority of flu deaths are amongst the elderly. Implementing strong infection management controls post-COVID has the potential to save many more lives in the years to come. Next, I wanted to talk about the public sector and in particular hotel quarantine. While workplace transmission may have spread the virus, the second lockdown in Melbourne originated as a result in breaches of hotel quarantine. The final report into these breaches identified a number of structural problems in the setup of the scheme, and I don't intend to go through them all now, but also made recommendations related to the health and safety of those workers exposed on a daily basis to COVID positive people. These included that the DHHS had a significant lack of health infection prevention experts upon whom to rely. This cascaded into a consequent failure to induct, train and supervise workers going into the site. Labour hire contracts were signed for security at extremely short notice, and those workers weren't properly trained to operate in that environment. Hotel cleaners should have been directed and overseen by personnel with specialist infection prevention and control expertise. There was a failure to provide appropriate PPE and a failure to train in the donning and doffing of that PPE. It's probably worthwhile noting as well that this whole idea of initially we were told that COVID was spread through droplets, although what became apparent is the aerosol nature of the spread as well. So the PPE itself perhaps wasn't adequate. I'll talk about that more in a second. The recommendation from the Victorian Government review was that every effort must be made to ensure that all personnel working at the facility are not working across multiple quarantine sites and not working in other forms of employment. To achieve this, every effort should be made to have personnel working at quarantine facilities, salaried employees with terms and conditions to address the possible need to self-isolate in the event of infection or possible infection, or close contact exposure, together with all necessary supports, including the need to relocate if necessary and have a managed return to work. The CPSU, which has done a lot of work in hotel quarantine, has reported that from the early days, DWGs have now been established, workers have elected HSRs and the HSRs have undertaken training. Similarly, delegates have been elected at every site. This workforce that has been created is on proper salaried arrangements, is flexible and skilled and able to respond quickly to emerging issues, so that if a new hotel does need to be opened up for whatever reason, the workforce is now flexible enough to hit the ground running. There's daily testing of staff, mandatory vaccination, so the vast majority of staff now are fully vaccinated, and they report a really positive working relationship with management. They're being able to identify issues and workshop solutions. Next up, more quickly now, the hospital sector. In the early days, there were PPE shortages of masks and gowns, and there was a worldwide scramble to source sufficient quantities of PPE. In April and May, a joint task force was set up involving government departments, including WorkSafe, representatives from the hospitals and unions to raise issues and problem solve. This collaboration process was incredibly valuable in terms of providing feedback from the shop floor. Very often, what's actually happening gets lost as it makes its way through the various levels of government, and also getting consistency in government advice from different departments, which was a problem in the early days as well. Department of Health was saying one thing, WorkSafe was saying something different, other departments were putting out notifications as well. An example of this, coming back to the spread via aerosols, is that the Victorian government guidance addressed the potential for COVID to be airborne in July, August of 2020. We compare this to the Commonwealth advice, which followed that of the World Health Organization, who did not address this point until June 2021. Consultation and collaboration has been very useful in the health sector, and hopefully it can be maintained beyond COVID, as there are many other pressing OHS concerns in the sector: occupational violence, psychological health, and musculoskeletal injuries, to name a couple. 3. Finally, I wanted to talk, well, I say finally, there's heaps to go. The last of our essential industries I wanted to talk about was the supply chain. Although we associate workplace outbreaks with meat works and aged care, at the peak of the second wave in Victoria last year, warehouses had the third most number of cases. Warehouse workers are in a high-risk industry due to working in an environment with a lot of close contact and interaction between workers. Additionally, so they're handling all manner of consumer goods, including food, that need to be moved even during a pandemic. The UWU, which covers many warehouses in Victoria, has been organising casual and labour hire workers around the issue of secure employment for many years. Through the prism of strong OHS structures, there were several notable actions last year in response to what workers perceived to be an inadequate response from their employers, and I want to discuss one in particular. Toll is a third-party logistics company. They provide third-party warehousing for a number of clients. In Truganina, they operate a large site for Kmart. This site has over 50% labour hire. Once again, many of these workers are working across multiple sites to make a living income. In August last year, close to 300 workers stopped work. A worker had tested positive on site, but Toll wouldn't disclose to workers and HSRs where that worker had been working, which workers had been exposed, or which parts of the warehouse had been deep cleaned. They simply said things were safe and everyone needed to continue working. When HSRs issued a cease work, management activated the PA system and threatened everyone with disciplinary action. Managers physically blocked the exit points, telling workers who attempted to leave an unsafe workplace that they were going to be fired. Workers did not breathe easy until WorkSafe arrived, and within 10 minutes of that, the workers knew that the regulator would support the cease work in this instance. So if we can derive any lessons from this, it's that casuals will come to work, sick or not, because they've got mortgages and bills and they've got to put food on the table, just like everybody else. We'll look at a few minutes about how the state government has addressed some of this. Secondly, casuals will come to work sick or not, because if they miss a shift, a black mark is placed against their name. This cannot be dealt with short of changing the structures of the workplace employment and the attitudes on site. Casuals are put under a lot of pressure to work unsafely and do not, or feel they do not, have the agency to refuse that unsafe work. And ultimately, UWU members won because they had good HSRs and union delegate structures. The elected rep showed strong leadership and workers who were prepared to back themselves and their elected reps in. These disputes could have been avoided with proper consultation with HSRs, discussing the issues, identifying the risks, and consulting on the control of those risks. The next thing I wanted to talk about is working from home and some of the attendant complications there. Although working from home is a practical and effective control against the risk of contracting COVID-19 in the workplace, new risks have emerged that need to be similarly controlled. The first thing I wanted to address is psychological health. Working from home means that workers are often socially isolated. They're unable to physically be in the same space as their colleagues. There have been studies that show that this has resulted in decreased social interaction, a tendency to overwork, and an inability to psychologically detach from work, and an increased rates of depression, anxiety, and stress. Various studies also show that working from home can actually increase work-related stress. The psychological impacts of this are further amplified by the fact in 2020, it all happened so quickly, and for many, working from home was involuntary and rushed measure. Although working from home has become much more prevalent as a result of the pandemic, the issues around establishing clear boundaries between work and home that were prevalent before, and unions have been fighting for the right to disconnect. I would like to talk about a case study that came through the Young Workers Centre at BTHC last year. Last year, 4 young workers contacted us about intimidation and harassment at work. They worked for a company that undertook copywriting and editing work. Many of the workers were employed as cadets, despite having duties associated with more senior classifications, although that's an industrial issue, perhaps. During the work from home restrictions in place in Victoria last year, they were subject to a number of surveillance measures, including being required to be on Zoom at all times and having to share the screens as they worked. They were often required to work for longer than 8-hour periods at a time, and they felt they could not appropriately log off for the day as they were being watched. Some of them were even queried as they got up for lunch or went to a toilet break. Both before and during the lockdown, the employer spoke to workers aggressively if mistakes were made. The workers said that the frequency and intensity of this aggressive communication became much worse during the lockdown, and they cited that they once witnessed their boss punch a hole through his wall when speaking to one of his employees over Zoom. This caused many of the workers immense psychological stress in an already stressful period of time, the pandemic. A number of them felt they had no choice but to leave the company because of their boss's behaviour. They did join the relevant union, and they've begun a process of enforcing their OHS rights and fighting for unpaid wages as a result of the incorrect classifications under the award. Supported by the Young Workers Centre. The next thing I wanted to talk about was ergonomics. Along with the psychological risks, working from home also presents challenges around practical workspaces, especially in industries where the workforce consists of renters in share houses or people living out of home. Although working from home may be reasonably practicable for homeowners, people in share houses did not have the same benefits, having to juggle concentrating on work whilst living in the same space as multiple other people who may or may not be working in the same workplace, or who may or may not be working at all. And it just blurred the lines between work and home life. And this further contributes to the aforementioned psychological impacts. A couple of points there. The first would be that because we all had to go home so quickly, some of the ergonomic considerations just weren't being able to be made properly. Is someone's working space correct? Is the desk at the right height? Do they have a proper monitor, a proper mouse? Do they have what's their work environment like? Working from home pre-pandemic involved all of those considerations and could be done over a period of time. Whereas when the pandemic hit, everyone was within a week working from home. And I know at Trades Hall, we had people take things from their offices, from their desks, but also had a system where if someone did need something, it could be ordered and delivered to their house. The other story I wanted to share was actually happened to a friend of mine who works in the government sector. And it probably just starkly illustrates the different experiences from working from home. They logged on and a senior, I shouldn't have probably said public sector, forget I said public sector. They logged on to a meeting one morning and their senior manager was there and she had a coffee and she said, "Oh, it's lovely. We've come down to our home in Ocean Grove and I walked the dog on the beach this morning and then we stopped and got coffee. And look, here I am back in my home at my desk." And, you know, there's a nice pool in the background and quite a nice place to isolate. Meanwhile, my friend is sitting there in her room at a not particularly OHS compliant desk with headphones on because her flatmate is in the next room also having a meeting, and she's barely, she gets up, comes out, has breakfast and goes back into her bedroom and spends the whole day in meetings there. And just that kind of disconnect between the two experiences. Her other housemate is clashing around in the kitchen making lunch because her other housemate was in the hospitality sector and has been stood down. Great. Oh no, there we go. Finally, wanted to talk a bit about returning to the workplace. As lockdowns have eased throughout the state, people are returning to work from home and resume working in more traditional setting. And that alleviates a few of the immediate psychological impacts of working from home. However, returning to work presents a new set of challenges for workers. Employers need to maintain a safe workplace, and the risk of contracting the coronavirus is not eliminated. Therefore, as more and more people travel to and from work, places like train stations and public transport become more and more likely to be a source of infection. In fact, in the most recent lockdown in Melbourne, train carriages and train stations were some of the first places to be listed as exposure sites. In city offices, the space restrictions around using lifts may also make a return to work impracticable. Furthermore, as more and more people get vaccinated, slowly, incredibly slowly, as well as vaccines becoming mandatory in some high-risk industries, there may be a perception that this is the only control measure required and that once vaccinated, people are completely safe from the virus. This is demonstrably untrue, as there have been examples of people contracting, displaying symptoms and passing on the virus even when they are vaccinated. Therefore, control measures such as PPE, administrative controls such as displaying how many people are allowed in the workspace or asking people to check in are also necessary in mitigating the risk. The virus has not simply disappeared, and as we have seen recently, it can come back in more virulent variants if employers are not vigilant in providing a safe workplace. Now, I wanted to talk a bit about government assistance and the types of aid at both the federal and state levels and the strengths and weaknesses of their coverage. The first up was JobKeeper. VTHC and VECI joined together to call for a federal wage subsidy early last year in the pandemic. The ACTU joined that chorus, and eventually this morphed into JobKeeper. It was initially a $1,500 subsidy for employers to help them pay staff costs throughout the pandemic, but it was reduced in tranches before winding up completely on the 28th of March this year. There were gaps in the scheme. A subsidiary, if your employer was a subsidiary of a foreign government, you weren't eligible. There was an example of some people in the airport who supplied food for planes who were owned by the Singapore government. They were stood down, they were ineligible for JobKeeper. If you're a long-term casual employee, you're entitled to it, but only if you were employed on a regular and systematic basis in the 12-month period that ended on 1 July 2020. As we know, casual employees generally do not have regular and systematic employment, or certainly there's a very large contingent who missed out on JobKeeper. And this affects two industries, retail and hospitality in particular, who were very severely affected by the pandemic, who also happened to be the two fields with the largest number of casuals. It also affected workers in the arts as well, who do a lot of gig work, a lot of part-time contracts for theatre shows or whatnot, who aren't able to establish that 12 months. There was also JobSeeker. Casual employees who were not eligible for JobKeeper may have been entitled to JobSeeker, which was a fortnightly $550. JobSeeker is just JobSeeker, but there was a fortnightly $550 coronavirus supplement, which dropped to $250 before ending completely on the 31st of March. It's estimated the initial supplement lifted 425,000 people out of poverty. The initial cut to the coronavirus supplement pushed 370,000 of those people back into poverty, according to the Australia Institute. There we go. So there's a nice little graph. That red line is the coronavirus supplements, and you can see quite nicely the steps down, and there is no official poverty line, but there's a couple of different standards there. And you can see how the initial supplement pushed a bunch of people out of poverty. And there were a number of stories in the media as well, you know, people going to the dentist for the first time in years and getting medical treatment that they've been neglecting. So there are perhaps a whole flow-on effects to giving people or lifting people above the poverty line. Okay, there was a one-off lump sum there's a one-off lump sum payment to help workers unable to earn income due to a COVID-19 lockdown, hotspot, or period of restricted movement, when those restrictions last for more than 7 days. If you lose less than 20 hours, it's $325, and more than 20 hours is $500. This scheme's under review now that Sydney's gone into an extended lockdown. it was a one-off payment, but I believe the one-off payment can be made on a granted on a weekly basis. It really just depends on how the federal government wants to administer that. But that was the replacement of JobKeeper. There's pandemic leave in the awards. For a set period of time, certain health awards were amended by the Fair Work Commission by applicant of the various unions in the ACTU, providing 2 weeks of paid leave for eligible workers, which once again excludes casual employees unless they're on a regular and systematic roster. 99 other awards also received unpaid pandemic leave, allowing up to 2 weeks unpaid leave to or taking annual leave at half pay. Whilst these measures alleviated the stresses of many workers, there were those frozen out in these compensation packages. I've already mentioned casual workers. In July 2020, the Premier, Dan Andrews, described the rapid spread of cases during the lockdown in Melbourne as a commentary on insecure work. In response to the gaps in federal support, several schemes were launched. Once again, unions were at the forefront of lobbying the government to implement programs to support marginalised workers and making the argument that COVID will spread further if these workers are not supported. Overall, the federal government schemes were set up to assist those in permanent employment to the disadvantage of marginalised workers in insecure employment, those most likely to be living a more precarious existence and taking the most risks. The state government schemes were designed to plug the gaps, but the state is not really set up to deliver income relief programs in the same way that Centrelink has an established role. The first thing the Victorian government did was a test isolation payment. Victorian workers can apply for a $450 coronavirus test isolation payment that provides financial support while they self-isolate to wait for the results of a coronavirus test, and they do that through the DJPR. This only applies to workers who have no paid leave available to them, including those workers who've exhausted leave. And so far, I believe that scheme has cost $141 million. Well, I saw that figure. It's probably a bit out of date now. I should say initially, I think the payment was $300 and it was lifted to $450. Additionally to that, there's the coronavirus worker support payment, a $1,500 pandemic leave disaster payment, a one-off payment to help Victorian workers who've been directed to self-isolate or quarantine, or care for someone who's been directed to self-isolate or quarantine. They also made an international student payment. So we know there are a lot of international students who were stuck in Victoria. A lot of them did cash in hand work in the hospitality industry, at, of course, below minimum rates. And a lot of them did cash in hand work simply because their visas restricted the number of hours they're able to work. The international student payment, it was a one-off payment of $1,100 delivered in partnership with Victoria's tertiary education providers. Look, it was made, did I mention 33,000 international students? Probably didn't go far enough, but it's something. It's worth noting that the government has also launched a trial of unfunded sick leave, I'll start again. It's also worth noting that the government has launched a trial of sick leave for casuals. Minister Stitt said the risk of insecure work had been ignored during the pandemic, and we're putting our hands up when no other government has to improve the health and safety and economic security of these vital workers, she said. But we have, I'm going to editorialise now. VTHC was lobbied for this particular change. I personally have some mixed feelings about this. In that this is a stopgap from government. We're socialising the cost of employers' exploitative business models here. A permanent solution would be to overhaul the structures that have led to marginalised workers not having any access to sick leave when we all know people from time to time get sick, and if we don't want them to bring their bugs to work, we should make sure that they've got the ability to stay at home and not be financially penalised for that. How are we going for time? Oh, geez, I'll be really quick. COVID safe. The Victorian Trades Hall Council has been running a COVID safe workplaces project, which provides free and confidential advice around COVID safety to workers in Victoria. There are a number of factors of this program. The first is an information service. People can fill out questions online and submit them, and we'll be able to provide advice and assistance to the questions they may have. We have a checklist which helps HSRs and workers in auditing their workplace for COVID safety. If people find that their employer is not following any of the steps on the checklist, they can call us and we can offer advice on how to help them remedy that. There's outreach program as well. So we've been going to different communities to promote our message of COVID safety at work. We've held stalls in temples, mosques, at train stations and in shopping plazas and spoken to different people in the community regarding their rights at work around COVID safety. And finally, we also offer free COVID safe at work training to HSRs and workers, which allows them to be better prepared to addressing the risks in their workplace. They're 2-hour sessions, and I believe there's some happening tomorrow even. And they can be signed up for on our website. Thank you. I was going to talk about Sydney and New South Wales as well, but I think we've run out of time, so we'll just probably leave it there.
So that might be another whole topic in itself, Dominic.
Oh, definitely.
I think certainly, I think in your presentation, I think just to remind us about the vulnerable workers and how the casualisation has really led to those extreme exposures of the disease, I think was a very key reminder, because not all of us do work in those industries, and there's a lot of them. As you said, the meat workers, health, hospitality, hotel quarantine, supply chain, aged care, with some enormous numbers, and certainly it's very difficult to forget those deaths in aged care last year. It's quite a dramatic, possibly unnecessary step, especially with the examples around THC and the government-funded centres. I have a question for you. You mentioned around the mandatory vaccination in the hospital quarantine sector. How do you think the need for voluntary mandatory vaccination in the aged care sector will lead to possibly loss of employees, more people working across multiple sites? Any comments there?
Look, the position of the movement has been that we should just be encouraging everyone who's eligible to get vaccinated straight away, which includes the all aged care workers, because they are in a priority category. There was some confusion around rollout in terms of the state versus federal government, who was going to be looking after aged care homes. The federal government was going to roll that out in the aged care homes they oversaw, but they, as I said, they only rolled it out to residents, and there are still residents out there who still haven't, received their first or even second vaccinations as well. So look, there's probably an education piece as well to do. I think there's been a lot of talk about the communication of the necessity of the vaccine and what it's aiming to do. There's just a lot more work can be done there. So in terms of mandatory, going back to your question, I think there's some case law that suggests, I think there was, from Queensland, it was in relation to the flu vaccine. Probably everyone's aware of the case that suggests that certain employers and certain industries may be able to suggest that vaccines or require that as a condition of employment, but certainly it won't be mandated, or it doesn't appear to be mandated from a legislative or from a government level.
Right. Thank you. Apologies to the rest of the participants for getting in early on the questions. If anybody does have any other questions, we'd certainly welcome if you put your hand up in the chat. Certainly VASO reminded us or reinforced the inconsistencies in the payments, the ineligibilities, and there obviously is certainly a lot of further work that needs to be done there. I don't know whether through the Central Safety Group we're in a position to assist with that action around particularly basics like sick leave, things that we do expect to see. Some people do not have eligibility for that. Is Victorian Trades and Council still doing more work around those campaigns?
Sorry, I think dropped out there for a second. Was that a question?
A question around the inconsistencies in industries, particularly around what you mentioned around the availability of sick leave. Is that going to be is that a general Trades or Council program or something ongoing?
We certainly think that there's an over-reliance on casual workforce. In Australia, it's one of the highest in the OECD, and the view is that, as I think I've kind of made it pretty clear throughout my presentation, by marginalising and excluding workers from being able to effectively participate in OHS conversations. And there is the financial aspect, which I covered, and the government's kind of put support in there. But the other issue is that it's psychological as well. Labour hire workers, even if they had access to personal leave, even if they have access to government schemes to redress a financial loss, if the idea is you call in sick and we won't give you shifts for the rest of the week to teach you a lesson, even if you had the ability to access paid leave, you still probably wouldn't. And people do go to sick. And that kind of cultural change requires much more than a quick legislative, no such thing as a quick legislative fix, but that cultural idea. Look, in my presentation, we didn't even discuss farm work because although farm work has been affected by COVID because we haven't been able to bring in a bunch of back payers, and the level of exploitation that goes on Australian farms it's next level. Whatever I talked about in terms of casualisation in my presentation today, it's next level with what's going on in farm. People just fractions of what we consider to be a fair wage.
So Renata has shared your link to the COVID Safe Workplace website, so hopefully people can have the opportunity of looking at that site as well after your presentation. Yeah,
I would add, I'm sure Renata will be able to share our website as well. The COVID Safe website is it's designed to give a very basic information and then encourage people to interact further with us, and so we can kind of personalise and individualise the advice. Our other website, ohsrep.org.au, has a lot more general information about the pandemic, and Renata updates that pretty much weekly at the moment as well.
Excellent. That website is also up on the chat, so thank you very much, Renata. So we might close the formal presentation there. If you want to stay online with your screen open, you can maybe have more of a chat with Dominic over the next few minutes. I just use this as, thank you very much, Dominic. I think it really has highlighted the injustices in our community, and that we could all do a lot more to support those people who are vulnerable. The reminder that we have been recording this presentation. It will be available to our paid members on the Central Safety Group website. If anybody has any membership queries, they can email Marina at membership@centralsafetygroup.com. Next month, I think we may be touching again on COVID. We're having Alison Hunt-Sturman, who's the safety manager for Mercy Health, which covers both health and aged care in the private sector. And that will be on Tuesday, the 10th of August. So I'd encourage you to put that in your diary and join us again next month. So over to you, Marina. We might close the presentation and just open for some informal conversation.